Greetings, everyone. This is Chris Frederick with the Collaborative Care Collective, and I'm here and very excited to be with Dr. Phillip Steel, who will be presenting at this year's summit. Welcome, Dr. Steele.
Good morning or afternoon or evening, wherever you're listening in from. Just beautiful day here in Helena, Montana, and be fun to talk about this amazing conference.
Well, thank you, and let's get right to it. What will you present at this year's summit?
Well, when Dr. Tim Mazzola asked me to present at this conference, he's presented at a couple conferences I've put on about scapular dyskinesis. I've been teaching conferences on this topic, mainly one, 2 or 3 day conferences, workshops. And he wanted to put together a little bit of my conferences, add in the collaborative component, which is new and exciting. I've been working with Dr. Brad Fullerton and Dr. Tim Mazzola, and then Gail Wetzler and Diane Lee, and many amazing physical therapists over the last several years. And what this conference will do is sort of allow us to bring in some of the stuff that I've done in past conferences, but a lot of new areas that I've not kind of delved into. And what's important to me is that the bulk of patients that I see from all over the country and international as well is that people show up and most of them have never really had a decent scapula exam as part of their chronic shoulder pain. And it's kind of disheartening to me how little physicians know, and many physical therapists know about the scapula. And so the goal here is to have a better understanding of that. And I've always began all of my workshops with sort of what I call beyond the scapula, and how to evaluate all the parts that contribute to the scapula. So I begin the conference with a simple fact that 28 muscles help you breathe, and 18 of those same muscles help your scapula move. And so there's this huge interplay between the scapula and the respiratory thoracic system. And so we begin the conference. Diane Lee's going to do some presentation, and I'll do a presentation on sort of looking beyond the scapula, sort of bridging in these other areas that are critical for normal scapular function. And that's kind of how we start the conference, is sort of looking, I like to think of beyond the scapula, these other critical areas that heavily influence shoulder function and neck function.
Excellent. I would have to agree with you. The scapula is not as understood. That's what they call the shoulder complex, isn't it? One reason is because the scapula makes it complicated because it's floating and it's dependent on so many factors as simple as myofascial imbalances and many other things. So I am so excited myself personally to hear you present this, and I'm sure many others will be. So you have attended and spoke at many conferences. I know that. What makes, we'll call it Collaborative Care Collective, we'll call it the C3. What makes C3 Summit so special?
Well, it's interesting. I've taught so many conferences and workshops, including conferences with mainly focusing on MDs and DOs, looking at the scapula and the pelvis and the lumbar spine. And last year, the first inaugural C3 conference was a collaborative conference where we had all the players come in, surgeons, to PTs, to bodywork people, to people like yourself, all kind of came together, and we shared ideas, which was sort of new and novel. Nobody does that. And what's interesting is, I've spent a lot of time over the last several years having PTs come, renowned physical therapists come into my clinic and see some of the concepts that I'm doing and the things that I'm seeing that I'm describing, but no one's ever developed physical therapy exercises for. And everybody sort of comes together and we come up with new ways to look at a problem and come up with new insights to that problem. And if people are willing to listen to new ideas, you can all of a sudden find ways to treat patients that you've just never been able to make an accurate diagnosis with. And sort of case in point for me is I see people come to me with chronic neck and shoulder pain from all over. And with Dr. Fullerton's teaching, Dr. Mazzola's teaching, Diane Lee, and all the players are at this conference. I've been working with a lot of them. We've come up with new and novel ways to evaluate the neck and try to treat the neck, as well as new ways to look at, the scapula and the lumbar spine, as well as the pelvis. I work with multiple people now, and it's just such an incredible and exciting interaction and collaborative approach. And that's what this conference is supposed to help you do, is understand that by bringing all the players into this um, uh, patient problem, we can come up with new ways to help solve these problems that really are meaningful to the patients. I see so many people that come to me and they've seen 20 doctors, and they've seen they've had 100 MRI. I mean, the number of MRIs is insane, and some of these people have had. The thing that's striking to me is the tears shed in my office that we're able to make a diagnosis where everyone said this is all in your head, and um, and that is so empowering to patients to understand that there's people out there that can actually make a diagnosis and determine why they're having chronic pain. And that's where it's so important that this collaboration works, because these people come to me, I can diagnose them, I can treat them, but I need a place for them to go back home where they have this same knowledge base and can treat these people. Because it's not just my treatment that's going to solve all of this. I can't, as important as my work is, the work on all the other people in the team is just as important. And that's where the collaboration comes. So if you're an MD, bring your favorite PT to this conference. If you're a PT, bring your favorite doctor. If you're a bodywork specialist, bring somebody that can be part of your care team. And I think that's what's critical, is bring a team of people to this so that you can expand your horizons, expand your ability to treat these problems, and help these poor people that are just have given up hope. They're oh, you're just depressed and it's all in your head, you need to take these pills. Well, they actually have real pathology that can be identified, and we can help them, but it takes a team of providers to do that, not just one individual. So that's kind of my passion, is how we can sort of work together to solve these problems.
Dr. Steele, I can feel your passion, and I can't wait to get together with you and the team when we present this summer. Let's have some final words from you as we bring this to a close on why you believe physicians should come. I tend to think the younger physicians, they're trying to feel their way through the system. They're frustrated with the system. They see people, they hear about people like you and others on the speaking that are presenting at the summit, how that is there another way? Is there another way to practice medicine? A better way? Can you really make it your own when they feel like they're stuck within a rut in a system? Do you have any words of inspiration that, in addition to saying just come and they can meet you and actually speak to people like you and others that would inspire them? Any other words of wisdom about why they should
Well,
come?
that's interesting that you say that. And I tell this to a lot of my patients. I said, my mentor in medical school pulled me aside one day, and just super famous immunologist. I did research in his lab for years, and just a brilliant man, Dr. Harry Hill, out of University of Utah. And one day he sat me down. We're sitting in his office, and he said, "Phil, I want you to take something to heart, and it will make you better at what you do." And I was all ears. I'm like, "What?" And he goes, "To be a good physician is to be a good detective." And I've taken that to heart my whole career. And coming to this conference is all about becoming a good detective, learning new ways and new insights into how to look at a problem, new ways to envision what's happening with people. I was presenting at a conference years ago. And I was sitting next to this guy. I didn't know who the heck he was. And I get up and gave this huge lecture on how variation of the brachial plexus causes cervical radiculopathy and causes scapular pain and shoulder pain. And these variations are highly prevalent, and
Mm.
there's no real way to identify them. And I sat down, and this guy sitting next to me goes, "That was amazing." And he got up and he was the next speaker. And I'm like, "Oh, okay, thanks." And he got up and did this amazing lecture on fascia. Of course, everyone knows if somebody gave a great lecture on fascia, it's probably doc, um, oh my God, Dr. Brad Fullerton. I was
There
sort
you
of
go.
blushing here. So Brad got up and gave this amazing lecture. And I'm like listening to this lecture because in my lecture, I said, well, it's interesting that nerves all travel through fascial planes. And he was explaining to me all these fascial systems that I had no idea about. Traditional MDs know nothing about fascia, but it's probably one of the most important structures in the entire shoulder girdle. And
Mhm.
and it's not the only structure, but it's really critically important. And what's amazing is that through Brad's teaching, I've learned a whole new way and vision of looking at the scapula. And so I thought I knew all this about the scapula, and everybody said, "Oh, you're like one of the best scapula guys around." And then I met Brad, and I'm like, "Oh my God, I have to learn this whole new system." And so I dove in feet first, and been swimming against the current, trying to learn all of this. And it's totally changed my practice. And I now know that when I went to medical school, the shoulder was all about the rotator cuff. Rotator cuff this, rotator cuff. Well,
Mhm.
the rotator cuff is just the victim in this crime.
Mhm.
It's the fascia and the scapula that perpetrate all the crime, and the scapula, I mean the shoulder rotator cuff is just sort of where we see the problem. So, traditional medicine's about MRI of the shoulder, fix the rotator cuff, rehab the rotator cuff. Well, not so fast. There's so many facets into the fascial system of the scapula and the shoulder, which are critically important, and that's the beginning of the end for almost all rotator cuff pathology in my mind. And since I've changed my approach to looking at shoulders, my outcomes have totally changed. So if for MDs that say, well, I treat shoulder pain, if you're not treating fascia, you're not having the success that you think you are. And your patients are going to come back again and again with the same problem. And so we all think we're, oh gosh, look how smart I am. And then you realize there's this whole branch of medicine that
Mhm.
you don't have an idea about. And so that's why if you're a physician, you need to come to this conference. You need to bring your team with you so they can be part of this process of learning and teaching their patients how to get better. I now give all my patients my rotator cuff protocol, which is mainly scapula and working at breathing and other aspects of pelvis and lumbar as part of their program. And my outcomes have totally changed because it's interesting that, 70% of patients that have shoulder pain also have low back pain. And if you're
Mhm.
not looking at low back and pelvis and diaphragm and the thoracic and ribs as part of your comprehensive evaluation for the rotator cuff, you're missing a ton. And so this is what this conference is all about, trying to bridge those gaps, bring the team together so that you can have the outcomes that you really deserve. And you can operate on a rotator cuff, but you're not going to get the success that you really need if you're not incorporating these other aspects in your plan of care.
Thank you so much. That was so inspiring, content rich. And you heard him, folks, Dr. Phillip Steele, right here not in person, but you can meet Dr. Steele and the other presenters at the summit collaborativecarecollective.com is where you register for the summit coming June 2025. We're looking forward to seeing you there. Come one, come all, physicians, physical therapists, physiotherapists, as they say in Canada and other places, and allied health practitioners. It's going to be an exciting program. Check it out at collaborativecarecollective.com. We'll hope to see you there. Until then, thank you again, Dr. Steele, and to all.
Hope to see you all there as well. It'll be fun.